tricky, if this is all right, what's tricky is really how do we figure out where the patient is? So what's most important to you in receiving treatment for your illness? What are you hoping for? What are your concerns? What are your fears? I was just talking to a patient today where we really needed to figure out what her fears were. What was she wanting to avoid? In point of fact, it was a discussion I was having with the husband about an elderly woman on dialysis with dementia who every time she came in for a treatment, she started crying, and the nurses thought she was miserable and really didn't want dialysis, but she didn't have sufficient decision-making capacity to be able to express that she really didn't want to be there. So I really found myself asking the husband, what are your hopes for further treatment with your wife? And what are your concerns? What are you worried about? And he didn't want to lose her, but I needed to engage him to figure out what his concerns were and to try and see what he saw as her current quality of life and what concerns he had with either her continuing treatment or not continuing treatment. So I just throw that out because, you know, sometimes in medicine, hate to say it, we're very linear. We're just focusing on the task at hand. And sometimes if we take a step back, and we look at the whole psychosocial situation, sometimes the answer is in going there. Because although the prognosis to us in textbook form is very clear, the answer sometimes means finding out the overall goals and then giving them information about how the prognosis fits into that.
Well, that's great. I think coming back to the idea of what your hopes are is the idea that there may not be a reasonable expectation. And then
exactly
same language as the I wish statement too. So it's an opportunity to say, I wish that were the case, but that's not going to be the case. And so where does that leave us? So
right.